Hi, everybody, and welcome to part 3 of the central nervous system lecture. So last time we focused on the cerebral cortex, more specifically the frontal lobe, parietal lobe, occipital lobe, temporal, and insula, where we took a look at the data being collected and processed, sensory data, as well as voluntary motor control through the frontal lobe. Now, today our focus is going to be shifted to the multimodal association cortex, which is depicted in pink here. So we're going to take a look at them and briefly go over some of their main functions and possible imbalances and medical conditions. So let's go ahead and get started with these, the names of these association areas. So functions of these association area. So what they do is they actually help you complete or perform higher level analytical functions. Such as functions include multitasking, critical thinking, memory, behavior, recollection of objects from your working memory, and reasoning and planning an action. So all of these are associated with your association areas. Now, in reality, the association area, which is also known as the multimodal association areas, there are 3 separate sections. What we identify as anterior association area, what we identify as posterior association area, and the last one is the limbic association area. Again, these multimodal associations are extremely important in terms of creating or making you who you are, being able to carry out tasks like multitasking, critical thinking, memory, thoughts, sensations, conscious awareness of your environment, making decisions, and feelings such as anger or expressing emotions. So we're going to get started with what we identify as anterior association area. So as the name implies, anterior association area is located in the frontal lobe. It is considered one of the most complex regions of the brain. Some of the functions, and again, this is not everything, some of the main functions include reasoning, planning, creating judgment, being able to react to your social environment, basically following the norms, trying to fitting in behaviors in an environment that you are at. It also helps with cognition, recollection of information, making you who you are. So developing your personality, your intellectual capacity, all of these are associated with anterior association area. So you can imagine if there is any major damage to this frontal lobe, then there is going to be more specifically prefrontal cortex. There would be significant changes probably in your capacity to function and act within your normal environment. So in the same note, some of the homeostatic imbalances that may be present in the anterior association area can make typically a mental or personality disorder that can lead to loss of judgment. So you basically would not be able to make right decision. Attentiveness to your environment, so you won't be able to participate or actively get engaged, and also removing of inhibitions. So what you would have think to be okay or not to be okay, I guess I should say, then you might not be able to stop yourself from doing certain things that are considered quote unquote inappropriate. For instance, you may stop taking care of yourself. You don't care about your appearance. You may use vocabulary that you might have not used before in a social environment. And again, a lot of times, a lot of people may also see personality changes. They may actually go into depression mode. So there was a case maybe a year ago now where there was this young Olympian cyclist, I guess I should say, where she had this really beautiful personality and very upbeat, very happy. And she had an accident with her bike where she hit her head. And not long after her accident, she actually uh, underwent a significant personality change. She suffered from depression and eventually committed suicide. So these behavior changes are significantly influenced by the prefrontal lobe, which is your anterior association area. The other thing that I also want to mention is the kind of the idea of your cultural acceptance, what you accept as a good behavior within your social environment, what we consider as norms, is also associated with your frontal or prefrontal cortex, this anterior association area. This part of your brain develops during childhood and puberty. And then after that, it pretty much stabilizes when you reach adulthood. Now, why do I mention that? This has a lot to do with people who may migrate from a culture to a different culture. So I am originally from a migrant family. So when we came here, I was about 15 years old, and I had not the best time, but I didn't have a significantly different difficult time assimilating into the new culture, even though it was significantly different from my original culture. However, when I think about my parents had a much more difficult time assimilating into the new culture, and they still kept their old cultural norms and cultural acceptance policies. So the main reason was that because I was a child or a teenager at that point, my prefrontal lobe, my anterior association area, wasn't fully developed. Versus for my parents, that area was fully developed, and therefore it was much harder for them to adjust to the new culture compared to a child that still was undergoing those changes, and they could embed the new culture into what they previously know. Now, when we're talking about the posterior association areas, which is what you basically see in pink right here, this area is part of both the temporal lobe, I guess part of the temporal lobe, the parietal lobe, and occipital lobe. So it is, as you can see in the picture, is a relatively large area. Now, again, it carries many functions, but one of the main functions that we want to talk about is the fact that it allows you to recognize patterns and faces within your environment. And the second thing, which I think is fantastic, is the dashed area you see right here called the Wernicke's area. This is part of the brain that is responsible for your ability to understand written or spoken language. So basically, as I'm talking to you, your ability to understand what I'm telling you is being processed by your Wernicke's area. Now, right your Broca's area, which was this area, your Wernicke's area also have that whole concept of lateralization, as in left does one thing and right does something else. So in this case, for majority of the people, left Wernicke's area is responsible for understanding the written or spoken language, while the right side of the brain on the same region is responsible for understanding the emotional overtone of the speech. So as you're sitting there and you're listening to me, you're not only processing the vocabulary, but also you're understanding, how am I explaining to you? What is my emotional overtone? I'm excited to explain this concept, right? Or I'm sad, or I'm anxious, right? So being able to distinguish that is associated with the right Wernicke's area. Uh, One of the major imbalances that needs be, or one of the ways to identify uh, the result of the damage to the posterior association area is your inability to be aware of yourself within the space you are. So what does that exactly mean? So imagine um, you have a damage to this posterior association area. You may believe that part of your body is not yours, and therefore you refuse to wash it, clean it, or clothe it, just because of that region, you don't believe that part of the body belongs to you, which is quite sad, actually. Now, we also have the third association area called limbic association area. A limbic association area is part of what we identify as limbic system, and I'll talk about that later on. But the importance of the limbic system is the emotional impact that makes a kind of a scene that is important in your life to be transferred into your memories. So your ability to kind of recall information and as a result of an emotional impact. Now that can be happiness, sadness, trauma, whatever the reason is. The recollection of those memories, those scenes, as a result of that emotional emotional impact is associated with your limbic system. I always tell my students kind of like if you have a smell of, let's say, burning tires could be associated with an accident scene. Let's say you smelling a specific perfume may trigger something really good for you, like that's a perfume your loved one is wearing, or a smell can create a really negative effect in you. It can be associated with your other senses too, like if you see a clear image, if you see a person's face, if you hear a specific sound, you can also create those emotions. But because limbic system is directly connected into your sense of a smell or your olfactory sense, the emotion that are created and it's memorized or embedded into your memory is much stronger with a sense of a smell. Now, here is again highlighting the association area and the specific functions. We also have the Wernicke's area in the posterior association area. Please do note that even though here you have a specific arrows going to the sections of the prefrontal cortex, I don't need you to be able to be that specific as far as you know that this is the prefrontal cortex and these functions are associated with it. Furthermore, in this picture, we don't have the limbic system represented. As you can see in the next PowerPoint, limbic system is deep within your brain and therefore it is not something we can visualize on the superficial aspects. Now, we already talked about lateralization previously, the whole idea of the left and the right hemispheres do not carry the same job. So in this case, we're talking about the concept, we kind of connect the concept of lateralization to cerebral dominance. So cerebral dominance comes from the fact that one of the hemispheres of your brain is responsible for creation of a speech. Basically, for 90% of the people, for 90% of the people, the left Broca's area is responsible for creation of the speech. And therefore, these people are identified as right hand, as an left side is dominant, making you right-handed in terms of utilization of your muscles. The other 10% of the population have their Broca's area on the right-hand side, making them left-handed. Now, again, typically one way for us to kind of lateralization also is, in general, we say that left hemisphere is responsible mostly for language, math skills, and logic. And right hemisphere is responsible for more of visual spatial skills like drawing, music, emotion, and intuition. Now, please do keep in mind that just because somebody is good in math, that doesn't make them bad in music or drawing, and vice versa. Just because somebody is a good artist, that doesn't make them a bad person or a bad mathematician or a person that cannot use logical discussions. We just have this kind of the idea of left hemisphere carries most of these functions versus the other way. Now, continuing with your cerebral cortex, or more specifically, I should say cerebrum. We have talked about cerebral cortex in detail, right? Everything we described so far has been cerebral cortex. So what about the white matter of the cerebrum? So the white matter was basically the myelinated axons of the neurons. And it is important to keep in mind that these axons are the way that the neurons are going to communicate with each other. So in terms of communication, we have 3 classifications based on the direction the white matter runs. So bear with me. If you have 2 hemispheres, right? 2 hemispheres of the brain, this is the way you want to look at it without looking at the names. You want to be able to communicate within your lobe. So let's say frontal lobe with parietal lobe and temporal lobe and occipital lobe. So communication internally in each lobe. You also want to have communication between the 2 lobes, as in right hemisphere can communicate with left hemisphere. And then you also want your brain as a whole can communicate with the rest of your central nervous system, which is your spinal cord. So the red lines that you see extending within your individual hemispheres are called association fibers. These are white matter that are basically extending and connecting one hemisphere of the brain to another. Commissural fibers that are depicted in green dots, also known as the structure of your brain called corpus callosum, is responsible for communication between your 2 cerebral hemispheres. Projection fibers that you see in blue are responsible for connecting the brain to your spinal cord and enabling you to carry a lot of your higher functions. Here's another depiction. So they're showing you a coronal cut of your brain as is depicted here. Again, the red are limited to each of the lobes. These are association fibers. The green you see is connecting your 2 hemispheres. That's your corpus callosum. And the fibers are commissural fibers. And then you have projections or fiber projections extending from the brain down to what we identify as a spinal cord. And those are referred to as the projection fibers. Now, that is all I need you guys to know for the cerebrum and the cerebral cortex. Now, please do keep in mind that what I've described to you so far are basically not even scratching the surface of the nervous system, but it gives you a good idea or overview of some of the essential functions of your cerebrum. Now, let's go ahead and continue with your diencephalon. Now, diencephalon, as I mentioned earlier, has 3 parts. Thalamus, which is the largest of the 3. That's 80% of your brain, or sorry, not 80% of your diencephalon. and it's identified as a relay station for your senses. It also contains right in between it your third ventricle, where the cerebral spinal fluid flows through. What thalamus does, as I said, it's a relay station. So basically, you get signal from all of your senses, with the exception of your sense of a smell or olfactory. These senses get adjusted, cleaned up, basically, amplified if it needs to be amplified, and then sent to the corresponding lobe of the brain, let it be the parietal lobe, your occipital lobe, your temporal lobe, or insula. So it is a relay station, is a way for us to find a way, or quote unquote gateway to your cerebral cortex. You need to pass through your thalamus to be able to get to your cerebral cortex. Hypothalamus is the second structure within your diencephalon. It is located right below the thalamus, hence the word hypothalamus. It also contains what we identify as a nuclei called the mammillary body, and that is involved in acting as a relay station for olfactory sense. So all of your senses, with the exception of olfactory, was controlled by your thalamus. And instead of olfactory, your mammillary body acts as a relay station for it. We have an extension called infundibulum, which connects your hypothalamus to the pituitary gland for the purpose of either storing hormones in the posterior pituitary gland or controlling the release of hormone from the anterior pituitary gland. We, of course, will go into a lot more detail about that in the endocrine system lecture next semester. What are some of the functions of hypothalamus? It is, as I mentioned, a relay station for your sense of a smell or olfactory sense. It is also controlling a significant function of your autonomic nervous system, which is basically the fight or flight or rest and digest system. So some of the things that it can help control is your control of the smooth muscle, your cardiac muscle, secretion from glands, controlling the movement and motility of your digestive system, helping with the size of your pupil, either opening it or closing it, your heart rate, and your blood pressure. Hypothalamus also plays a major role in homeostasis, helping you maintain your environment and your body temperature, your food and water intake. So basically giving you your feeling of thirst and hunger. And then it also regulates your sleep and wake cycle with the help of your melatonin release from your epithalamus. In terms of the control hypothalamus has on the pituitary gland, I'm going to make a quick note for you. For the anterior pituitary gland, hypothalamus does not produce its hormone, but it controls the release of those hormones. The posterior pituitary gland does not produce any hormones on its own. Rather, it stores the hormone that was produced by your hypothalamus. There are two main hormones. These are called vasopressin, also shorthand to AGH, or antidiuretic hormone. The second one is oxytocin. This is involved in and release of milk during lactation period. So oxytocin is basically the hormone that causes muscle contraction of the uterus during childbirth, push the baby out. Some of the homeostatic imbalances that might be observed if there is any lesions or tumors on the surface of the hypothalamus. We can have severe body wasting as a result of the effects of the anterior pituitary gland. You can have symptoms of obesity. Uh, it could be both hormonal for the anterior pituitary gland or inability to sense when you are full. So that whole hunger response. Sleep disturbances, and again, that's related to the epithalamus and release of the hormone melatonin. Dehydration has to do with your hormone vasopressin, also known as ADA. So if you have not enough of ADA in your system, your body loses too much water and consequently becomes dehydrated. Epithalamus, as I mentioned, from the root of your Diencephalon, and it does contain multiple structures. The only one here is a structure called pineal gland, and pineal gland is the structure that releases or secretes melatonin. You may have heard of that again. It is the hormone that's responsible for regulation of the sleep and wake cycle with the help of your hypothalamus. Brainstem. So brainstem, again, there's a lot more function associated with it. We are just going to kind of brush over some of the main functions. Brainstem is divided to three parts: midbrain, your pons, and medulla oblongata. The midbrain itself has multiple structures. It has these two that are kind of highlighted for here. One called the superior colliculi and the other one's called inferior colliculi. Together, they represent a structure called corpora quadrigemina. So what is the function associated with the superior colliculi? It's responsible for visual reflexes. For instance, if you are following the lines on your text, that's your visual reflexes of the superior colliculi. Inferior colliculi, which is a smaller, is associated with your sense of auditory and create what we identify as auditory reflexes. When you get startled by a noise, when you turn your head around to see the reason for that noise, that is identified as auditory reflexes. Another structure that is very clear in a midbrain, and you can see it in a cross section of the midbrain, is a structure called substantia nigra. It's these semilunar structures you can see. These are essential because they are involved in voluntary motor, or basically control of muscle movement, or voluntary or skeletal muscle movement. Research has shown that if there is damage to the neurons or degradation of the neurons within the substantia nigra region, then there is a really good chance that that can lead into Parkinson's disease. Or in another sense, people who have Parkinson's disease, the tests have shown that there is significant degradation of neurons in this region. Now, one thing I do want to add, and this is going to be more in detail in your next week's lecture, is introducing your cranial nerves. So you have total of 12 cranial nerves that originate from your brain. Cranial number 1 and 2 is not included here. That's your optic nerve and your olfactory nerve or olfactory bulb. You will learn about them next week as well. But cranial nerves, what we identify as nerve number 3 and 4, which is called the ocular motor or your trochlear nerve, they both initiate from your midbrain. Pons is the larger of the three structures. It does bulge out, makes it easy to identify. There are three main nerves that are associated with your pons. There are nerves number 5, 6, and 7. The proper name for these nerves are trigeminal, abducens, and facial nerves. The name's kind of self-explanatory if you put some effort into it, but it also helps you as you go through the next week's lecture to identify the function, either sensory or motor functions for each of these nerves. What is the function of your pons? So function of the pons, and again, this is just kind of literally brushing over the functions. It acts as your secondary respiration center. So it works very closely with your medulla oblongata to help you maintain your respiration. Hence is part of a secondary respiration center. And secondly, it is responsible for some of the involuntary actions not involuntary actions, some of the voluntary actions like ability to taste, release saliva, release tears, your facial expression, creating a sense of equilibrium, and hearing. Again, it is involved in those processes, might not be the main structure for all of them, but it is involved in those processes. We also have the last part of your brainstem called the medulla oblongata. Medulla oblongata is the part of your brain right before your spinal cord starts. The cranial nerves that originate from that include cranial nerve number 8 through 12. And please be able to identify them using Roman numerals. So what is the job of the medulla oblongata? It is acting as your primary cardiovascular center. What does that mean exactly? It means that it has the ability to control your heart rate. So elevation and decrease of your heart rate is depending on your medulla oblongata. You also can carry out a process called vasomotor or vasomotor center, where you regulate your blood pressure by adjusting the thickness or the diameter of your blood vessels. So by vasoconstricting or vasodilating, you can fluctuate the pressure and therefore get a better control of the actions of your, also better control over your blood pressure. One of the last things I want to talk to you guys about is your cerebellum, which is the last part of your brain that is visualized on the first page of this PowerPoint. It's a couple of vocabulary, a few vocabulary for the cerebellum. So cerebellum, like cerebrum, has multiple lobes. They include an anterior lobe, a posterior lobe, which is much larger, and a small lobe right here called follicular nodular lobe. It is, like cerebrum, has a means of communicating between the two halves of cerebellum, and that connection point is called the vermis. You can see it better in this picture. Here is one lobe, here's another, and this area right in the middle would be your vermis. The other thing that you have is very similar to your cerebrum, which has the gyri. You also have ridges on the surface of the cerebellum. However, they're referred to as folia. And lastly, the white matter of the cerebellum creates a pattern inside your cerebellum called the arborete, as it resembles little tiny tree branches. Now, cerebellum, what is its job? It is receiving data from many places, including where your body is, data from your eyes, your ear, and your joints. Based on the data it receives, it helps your muscle, your skeletal muscle, to create the most effective and efficient movement that is smooth. So basically, it helps your skeletal muscle to function smoothly and properly. It helps you also maintain your posture and your balance. Now, I want to just kind of quickly go over this, and I always like to kind of help you understand it a little bit better. So if you think about kids or babies when they're born, they are basically unable to accomplish anything, right? They can't hold their head up, they don't squeeze your finger, they can't hold their bottles, etc. Now, what is happening is at that point, your cerebellum is not fully developed. So even though the neurons might be there, in typically the myelin sheath that is responsible for effectively creating action potential is absent in these neurons, okay? So at that point, it's hard for your brain to effectively communicate. Therefore, a lot of the skeletal muscles seem uncoordinated. That even extends to your eye movement, where one eye moves to one direction and another. Now, as time passes by, as months and years start to go by, then your axons within the cerebellum start to develop their proper insulation or proper myelin sheath on it. And as these myelination forms, the communication or the action potential becomes a more effective means of communication. And eventually the movement of the skeletal muscle becomes coordinated and smooth. As in, you won't notice how that you don't need to actively think about taking a step. Your actions, if you see something on your way, you just jumped over it or make the step larger. You don't see that in children, especially the ones that are just starting to walk, because again, that cerebellum is not fully developed. But through action and time, the myelination starts to form, and as a result, the motions become more controlled. Let's talk about memory, guys. Memory. There are two types of memory. You probably have known that. A lot of you guys, if you are cramming for your exam the last minute, you're relying on your short-term memory. And if you're one of those people that has studied throughout the time and a number of hours every day, then you are relying on your long-term memory, also known as LTM. Short-term memory is identified as a place you can temporarily hold your data, and it only can serve a few pieces of information at a given time. Long-term memory, however, is, as of our capacity goes, are identified as limitless. Now, when you have short-term memory, how does that short-term memory get transferred into long-term memory? There are some factors that can significantly affect that. That include emotional state. So if you're alert, motivated, and surprised and aroused, then there's a really good chance that data would be transferred from short-term memory to long-term memory. So basically, if you're listening to my lecture right now and daydreaming, the chances are you won't recognize what I have told you so far. Rehearsal, repetition. I always say the best practice is repetition, right? Or practice makes perfect, right? That repetition helps your brain figure out what you're studying is important and therefore moves that information to long-term memory. Association games. So I'm assuming all of you guys have played association at one time or another. You use the information you know to connect new information to. So for instance, finding this word rhymes with a word that you already know, it helps you recognize that word. Or finding phrases like never let monkey eat banana to associate that with the frequency of your white blood cells. And you guys, of course, have many examples of your own, and you can think about those. Autonomic memory. Autonomic memory is another way of thinking about transferring information from short-term memory to long-term memory, where your subconscious assumes the information is important for you and therefore actively transfer that information to your long-term memory. Here's again what I've described to you guys: rehearsal, excitement, right? Association, all of them helps you transfer the information from short-term memory to long-term memory. You can retrieve that information all the time from long-term memory to short-term memory. However, there are scenarios where, as a result of trauma or for whatever reason within your brain, a glitch in your system, sometimes the data becomes unretrievable, as in data is lost, permanently lost, and you will not be able to remember that information. Now, in terms of memory, you can have traumas that can affect your memory. Now, there's two main types of memory loss. One is identified as anterograde amnesia, and the other one is retrograde amnesia. Anterograde amnesia is where the memories are not lost, but the old memories are not lost, but you cannot create new memories and associate them to your old information. So basically, you're stuck in the past, if you want to think about it. The person lives in here and now, and they will not be able to remember information from after their accident. So if you ever watched the first 50 dates, basically she had anterograde amnesia. She had her old memories, but nothing new would be able to be memorized, added to her memory. Retrograde amnesia, which is also very common, is when you lost or lose your memory associated with your past. So people who are dealing with some sort of trauma sometimes also may lose the previous memory, and they can create new memories, but they lose the old ones, or they may lose part of their old memories. Lastly, let's talk about your brain waves. Brain waves, there are four main types, not necessarily these are the only types, but they're the ones that are essential for you guys to be able to have a general understanding of the brain waves. First of all, brain waves are measured with a machine called electrocephalogram, now I'm mispronouncing it, I apologize. Electrocephalograph, which is basically known as EEG. This machine again help you take a picture of or show the activity of your brain by monitoring the action potential of the neurons in the brain. Now, when we look at the brain, there are four main classifications of the waves. Three of them are associated with adults, and one is typically what we see in children. So alpha waves are what we identify as a person where they are basically daydreaming, or what we know as idling brain. So these type of rhythm or brain waves are very regular and rhythmic, and they're low in amplitude, which basically means they don't get too big. Beta waves, on the other hand, are going to be identified as when your brain is alert, it's aware, it's understanding what's going on around them, and it's recognizing and it's interacting with the environment actively. The rhythm of the beta waves are less regular because, again, you're effectively using your brain, and they are also rhythmic. Theta waves are the ones that are seen commonly in children. So typically you don't see these waves in an adult. They are higher in frequency, so you're going to see a lot of peaks. And they are typically irregular. And again, you would not be able to see many of these theta waves in adults. And lastly, we have what we identify as delta waves. Delta waves are really high amplitude but low frequency. So over time, you see very few of them, but they're pretty big in size. They usually happen when a person is asleep or is in deep sleep, or where we identify what we identify as reticular activities are being suppressed. Reticular activity has to do with consciousness. So whenever you hear that, just automatically connect that to your emotion of you knowing where you are, you being aware of your surrounding, you being conscious. So when you do see delta waves in patients that are not under anesthesia, but you still see these waves, that typically means that the brain activity is severely affected, and therefore is a sign of some sort of brain damage, which you can identify more in detail as you go over the pictures and carry out multiple tests. Here's a picture of what these four waves look like. Keep in mind again, you're looking at typically as amplitude and frequency of the waves, and alpha, beta, and delta are seen in adults, but theta waves are typically associated with children. In the same note, when we're talking about imbalances of your brain, you may have heard of seizures or epileptic seizures. Basically, a person has epilepsy. What happens in their brain is sometimes the neuron starts to misfire rapidly throughout the brain, and a person in suffering from this seizure, they will have basically uncontrollable jerking because the brain is unable to control the skeletal muscles. They do fall stiffly to the ground typically, and in some cases, they do lose consciousness. Now, please do keep in mind that if somebody has an epileptic seizure or is diagnosed with epilepsy, that really does not affect their ability to think and carry out the processes that a healthy individual would be able to do so. So it doesn't affect them intellectually. Sadly, about 1% of the population does suffer from epileptic seizure. There are components like genetic factors that can lead to epilepsy, but in many cases you can have brain injuries, a stroke, infections, and tumors that can also lead to an epileptic seizure. Okay, that's about it for this PowerPoint. Go ahead and watch the next part, which is Central Nervous System Part 4, to cover the rest of the slides. Thank you, guys.